Welcome back, everyone. This is Dr. Gallenstein, and today we're going to continue our conversation on the use of economic experiments, or RCTs, to evaluate the impact of development programs. And today, specifically, what we're going to do is we're going to introduce the integral approach to development economics and how it applies to the way in which we conduct and design RCTs, and even how it influences the design of interventions. Okay, so let's jump right into that. Now, first, to understand the integral approach to development economics and to understand how the integral approach applies to the use and design of RCTs to evaluate development programs, we need to understand some of the motivation, some of the background that influences the integral approach. Okay, so we're going to go through a little bit of that first, and then we'll just build up and we'll see how this influences our approach to impact assessment. Okay, so first, motivation. Now, the first and most important motivation or underlying principle behind the integral approach is that when we use the integral approach, we acknowledge the reality that humans are not purely self-utility maximizers. Okay, they're not purely self-utility maximizers. Now, a self-utility maximizer is someone that makes decisions to improve their own personal utility. They make decisions to maximize or to achieve the best for their own outcomes. And so under this view, optimal decisions, that means the best decisions that people can make, are the decisions that achieve the greatest welfare, well-being for themselves. Okay, so that's a self-utility maximizer. And what we're saying is that we are acknowledging the reality that humans are not self-utility maximizers. But instead, we're saying we are acknowledging the reality that humans are, in fact, relational utility maximizers. That's the term that we're using. What does that mean? That means humans make decisions as social persons. That means when humans make decisions, they don't make decisions purely based on their own utility or with respect to or with reference to their own outcomes, but by nature, humans make decisions with reference to and in collaboration with other people. When we as humans make decisions, we don't only consider how our decisions affect ourselves, we also consider how our decisions affect the people around us, the people with whom we are in relationship. It could be our family, friends, colleagues, community, society, the world. We make decisions as social persons. We make decisions to achieve the best outcomes for ourselves and for others. We make decisions with and for the sake of others' well-being. Okay, now under this view, optimal decisions achieve the greatest well-being for individuals, families, community, and society. The optimal decision that I can make is a decision that takes into account my well-being and the well-being of those around me. That is an efficient decision. Now, people might vary in terms of how much they make decisions based on or with reference to the world around them versus just reference to themselves. But the more that we take into account the consequences of our decisions for ourselves and for others, and the more that we make decisions in collaboration with others, the more efficient our decisions will be. Okay? So when we use the integral approach, we acknowledge the reality that humans are not purely self-utility maximizers, but they're relational utility maximizers. That means they make decisions as social persons. And if that's true, then the most efficient decision that people can make is if they make their decisions with respect and in collaboration with the people with whom they are in relationship, their families, community, society. Okay, those are the most efficient decisions. Now, if that's the case, then when we're thinking about the impact of a development program and when we're thinking about the design of a development program, we take into consideration the fact that every recipient of our program is a social person and not some purely isolated individual. Okay, so let's keep going. Now, so if humans are relational utility maximizers, now why do we say that? We say that because humans are by nature social. And because of that, the most efficient decisions are those that improve the well-being of themselves and others. They are made considering the well-being of others, and they are made in collaboration with others, okay? So because humans are social by nature, when we make purely self-oriented decisions, we're actually making inefficient decisions. We are making decisions that have negative consequences for the well-being of others with whom we share relationships and community. Okay, when we make purely self-oriented decisions, we are making inefficient, economically inefficient decisions. Okay, now this view of humans as relational utility maximizers has implications for the way that we think about economic development, and therefore it has implications for how we think about conducting impact assessments and how we think about the design of interventions in the world of economic development. Now, if we do not think of humans as relational utility maximizers and people that make decisions with respect and in collaboration with others, we miss things. So, for example, development interventions might fail because they do not consider the social structures in which they are implemented. If a development intervention is designed only with respect to a particular individual but ignores the community or the family that influences the decision-making of that individual, then a development intervention might fail. Or development interventions might fail because they do not consider the relational dynamics of individual decision-making. They do not think about the influences, the factors that influence the decision-making of the recipients of that development program. Okay, development interventions might fail because they do not encourage optimal, social-oriented decision-making. Or development institutions might fail because they do not encourage recipients to make decisions that benefit their families, communities, or societies. Poorly designed interventions can in fact encourage recipients to make passive decisions that hinder their ability to make full and productive use of the opportunities that they have available. Development interventions may fail because the intervention does not encourage active participation in the sustainability and the promotion of the intervention. Without engaged recipients who proactively pursue sustainability, many programs simply fail when external funding is removed. Okay, so these are some challenges that can come up if we do not think about people as social persons that make decisions with respect to and in collaboration with the people with whom they are in relation. If we think about people purely as individuals and not people that are making decisions with respect to the welfare of their community or with respect to the welfare of their society, then we could design programs that don't promote people to make decisions that benefit their community and their society, and then the intervention might fail because the recipients are not motivated or incentivized to make decisions that would help to promote the sustainability of the intervention. Okay, we're going to go into some more details in a minute. But these are the types of consequences, negative consequences that can arise if we don't think about the human person in the way that the human person is. The human person is a social person, not a radical individual. Okay, so now let's go a little bit more into detail. So when we use the integral approach, okay, motivated by a more accurate understanding of the human person, when we use the integral approach, our objective, or one of our objectives, is to design interventions or assess the impact of interventions with respect to their ability, the ability of the intervention, to help enable individuals or agents, persons, to become agents of change. Okay? Now, what do we mean when I use this term agent of change? An agent of change has two characteristics that we're going to talk about in our master's program, and we'll talk about again and again when we talk about using the integral approach to understand development. Okay, an agent of change is going to have two characteristics, or there's two components to this. One is proactivity and one is participation. Okay, proactivity, I will define it this way. Proactivity is a disposition toward taking action to solve material or social problems or relational problems, developing creative solutions to problems, and actively participating in those solutions. So a proactive person puts creative attention into creative steps, taking tangible creative action to solve material, social, or relational problems. Okay, a proactive person seeks solutions to problems. A good intervention will help people to become more proactive. Because when people are proactive, they are seeking to improve the well-being of themselves and those around them. Okay, and they can take charge, and they can help to promote the sustainability of interventions that are intended to improve their well-being and the well-being of those around them. Okay, so that's proactivity. An agent of change is proactive. All right, and participation is the other characteristic or the other component. Participation. Participation is making decisions that take into consideration the welfare or the well-being of others, and thinking about decisions from the perspective of others, and making decisions in collaboration with others. Okay, so a participatory person, all right, so we're going to say an agent of change is a participatory agent. A participatory person is one who makes decisions really thinking about the well-being of others, thinking about how their decisions influence the well-being of others, and making decisions in collaboration with others. Okay, so an agent of change is proactive and participatory. They take tangible, creative action to address social, material, relational problems, taking into consideration the well-being of others, how their decisions affect the well-being of others, and make decisions in collaboration with others. Such a person is an agent of change. Such a person is behaving and living to the full potential of being a relational utility maximizer. Okay, so an agent of change is a proactive and participatory agent, one who creatively seeks solutions to problems while collaborating with and considering the well-being of others. A good intervention is an intervention that helps to enable people to be agents of change. Okay, so now with that background, how do we utilize the integral approach to influence our approach to conducting impact assessments and our approach to designing development interventions? There's a couple of different ways in which this influences our thinking. One, it changes the way that we think about the target population for our intervention. Two, it changes what outcome variables we use. Three, it broadens our thinking as to why an intervention may succeed or fail, and then therefore gives us additional ways of assessing the impact of a program. And four, it changes the way that we design interventions, design experiments, and make policy recommendations. Okay, so the integral approach is based on a more accurate view of the human person. And with that more accurate view, we see that agents, individuals that make efficient decisions, make decisions as agents of change. They're participatory and they're proactive, which helps them to make the most efficient decisions because they're making decisions, they're proactively making decisions that consider the welfare and well-being of others and in collaboration with others. Okay, so that underpins the way in which we view the agents that participate in our study or are the recipients of our intervention, and therefore it influences everything about the way that we do impact evaluation and designing interventions, experiments, and making policy. All right, so then let's go deeper and let's see how it does that. All right, so an integral approach, thinking about our target population. Now, interventions typically target a specific population as the recipients of that intervention. So in this class, we've used numerous examples. I'll just take a common example we use of providing fertilizer to farmers. So we say, well, we want to improve the incomes of farmers, and so we are going to give subsidized fertilizer to farmers. We hope that that will help them increase their yields, and if they have higher yields, increase their income from selling their crops. Okay, so the target population are farmers. And those farmers are the recipients of the intervention. Now, that's typically the way that we think about interventions, is that we have a specific group of recipients. But the problem with the way of thinking about it that way is that when I'm thinking about farmers, I'm thinking about individual human persons that are social persons. They exist within a community. They exist within a family. So the target population is not just radical individuals making decisions in complete isolation or making decisions purely motivated by their own welfare. But in fact, those farmers, they are members of families. They're members of communities. They're members of societies. And those farmers make decisions with respect to the well-being of their families, communities, and societies. Okay, so when we are evaluating a program using the integral approach, we have to recognize that the target population, they make decisions in a social context and as social beings. So what does that do to our thinking? Well, when we think about doing an impact evaluation, we have to think about the context in which our target population exists. We have to broaden the scope of what our target population is. We have to think, well, who does this intervention target? Who are the individuals that they target? With whom do these targeted individuals live, work, and make decisions? Who is affected by the decision-making process of the recipients? And what other people influence the decision-making process of the recipient? What other individuals might have influence over the decision-making process? We have to think about the context, the institutional context. If I give fertilizer to farmers, the decision that those farmers make, those decisions will affect the well-being of their household, and the members of their household will affect the decision-making of the farmer. If I give fertilizer to farmers, that will affect the well-being of other members of their community, and other members of their community will affect the decision-making of that farmer. So it would be insufficient for me to simply analyze just that farmer, because that farmer is not a radical individual. That farmer is a social person. So when we use the integral approach, it broadens the scope. It deepens our thinking about the target population that we're working with and about the recipients of our intervention. Okay. Now, a little bit more tangibly, using the integral approach, we typically identify multiple groups as our target population. So we typically will think about the direct recipients of our intervention, so in our example, farmers. We also think about the family members of the recipients, so the other members of the household of that farmer. We think about the coworkers, colleagues of the recipients. Maybe the other members of a farmer group. If this farmer recipient is receiving fertilizer and they're a member of a farmer group, we also have to think about the other members of the farmer group. We should think about their community. We should think about other institutions that affect the decision-making of that individual recipient. We think about and we need to think also about the greater society. Therefore, when we use the integral approach, we typically collect data from representatives of various populations when doing the impact assessment. So if we're doing an impact assessment on farmers who are receiving fertilizer, we will collect data not just from the farmer. We will collect data also from a family member of the farmer, perhaps another member of their farmer group or farmer association, Perhaps we'll collect data from another member of their community, or perhaps we'll collect data from someone with whom the farmer works, perhaps the person to whom the farmer sells their crops, or from whom they purchase their inputs like fertilizer, other inputs like herbicides or advanced seeds or other inputs, etc. We will collect data from other people in the social network in which that recipient lives, because that person is a social person. Okay, so influence is our target population and who we collect data from when we do an analysis. All right, next, from the integral approach, it will influence the outcome variables. So far in the class, we have focused almost entirely on material well-being. We typically use outcome variables like income or yields or educational outcomes, things like that. Those are common outcome variables in the world of impact assessments. Okay, and those are important. When we use an integral approach, we do not discount the importance of those material measures of well-being, these material outcome variables. But when we utilize the integral approach, we recognize that there are additional things that we need to look at, additional outcomes that are important for measuring whether or not an intervention helps people to become agents of change, helps people to have more efficient networks or efficient channels of relationships that would allow them and those around them to improve their well-being. Okay, so when we use the integral approach, we will use outcome variables that measure material well-being, typical things like income, health outcomes, education, etc. We will also use measures that capture whether or not the recipient is engaging well within the network of relationships in which they live. Okay, so a good intervention recognizes the network of relationships in which a person lives and makes decisions, and a good intervention will improve the quality of relationships and empower recipients to make decisions that improve the welfare, well-being of their families and communities, as well as enabling them, assisting them in becoming agents of change in their social network, okay? And so what do we look at here? Well, typically we'll measure standard material outcomes like income, health, education, yields, etc. We also will look at relational outcomes. We'll use measures of the quality of relationships, or how proactive people are, or how healthy their personal decision making is. And we'll also look at how well people are engaging in their society and their community. So we'll typically measure social and civic engagement that measures participation or participants' contribution to the well-being of members of their household, well-being of members of their community, and the well-being and their participation in their greater society. Okay, so when we use the integral approach, we broaden the outcome variables that we use. All right, and lastly, when we use the integral approach, it affects the way that we design interventions. Okay, so if we're designing an intervention for us to use in conducting our impact assessment, or even the way it influences the types of policy recommendations that we give to our collaborators, the integral approach will help us to design effective interventions. Okay, so when we're using the integral approach and we're thinking about how to design interventions, there's several things that we must keep in mind. So to design an effective intervention, you must have a deep knowledge of the problems you seek to address and the context in which those problems exist. We need to understand what relationships influence the decision-making process of recipients. We need to consider how interventions might address material constraints and relational constraints. So then a well-designed intervention will help promote proactivity and participation among the recipients, help promote healthy relationships that improve outcomes for recipients and the community or the social context within which those recipients exist. All right, so that's what a good intervention must have. We have to think about these things in order to design a good intervention. All right, Now, I want to give a stylized example of applying the integral approach to improve to a development program. Okay, just to give an example of how we might use the integral approach, practically speaking, to help improve the impact of a development program. Okay. And we will hear more on this later in the class. I'm using a stylized example of an impact assessment that was conducted within the Integral Economic Development Master's program by some of the faculty. Okay, this is just a stylized representation of this intervention. We'll learn more about it in its particulars in class. Okay, so I'm just going to use this example. I'm going to title the example Improving Maternal Health Outcomes, an Integral Approach to Impact Evaluation. So to give a little background, in the West Bank of Palestine, an NGO wanted to improve maternal health outcomes for low-income mothers. In collaboration with two major hospitals, they began to offer mobile health clinics that would bring services closer to pregnant women. After the mobile health clinics were introduced, an impact assessment was done by faculty in our department, and they found that pregnant women in the target population sought medical care on average 2 times during their pregnancy, which is only 20% of the recommended number of visits. The NGO then sought to improve their intervention and identify the underlying cause of the low utilization of the health clinics. Now, using the integral approach, we first seek to identify both material and relational factors that influence the effectiveness of the intervention. And so, representatives of the research team conducted focus group meetings with the target population, as well as analyzed survey data to try to identify the causes of this low utilization of the health clinics. Now again, I'm using a stylized representation of this story. You'll hear the fully accurate and detailed story of this intervention in class. Okay, so focus group meetings as well as surveys were collected to try to identify the main constraints on the utilization of the mobile clinics. Now, using the integral approach, we're able to identify both material and relational constraints on the effectiveness of the program. Now, there were material constraints. Mobile clinics were still often too far away from where women lived, which made travel to those clinics difficult, particularly in the context of the West Bank, where travel is oftentimes restricted. Second, women and their households lacked adequate education on the appropriate number of visits to the doctor during pregnancy. And so, a typical design of an intervention would be one that is trying to ease these material constraints. That is, try to help women gain access to the mobile clinics, as well as educating households on the importance of prenatal doctor visits. Okay, but when we use the integral approach, we have to go deeper. We have to go deeper than the purely material constraints to interventions. We have to go deeper than the purely material challenges. And why do we do that? Because persons do not make decisions as radical individuals. They make decisions as social persons, which means their decision-making is influenced by the well-being of others. It's influenced by how well they are able to make decisions in collaboration with others. And it's affected by whether or not they make decisions with respect to the well-being of others. And again, because we're social persons, people make decisions in the context of other persons. Their decision-making is influenced by other people. If we were to conduct an impact assessment trying to measure the impact of these mobile clinics on pregnant women, and we viewed those women as radical individuals, we would miss an entirely a substantially important component of the decision-making process of those women. And the reason, and what we would be missing, is that those women do not make decisions in isolation. They make decisions in the context of their families and their communities. So, when using the integral approach, researchers were able to identify an additional constraint to the utilization of those mobile clinics. So these interventions targeted pregnant women, but women do not make decisions in isolation. The women made decisions in the context of their family and in collaboration with their family members, especially their husbands. If husbands and wives are not relating proactively, no action may be taken to ensure women get to the doctors the appropriate numbers of times. Okay, so just to make this clear, these women are not making decisions in radical isolation. Their decisions are made in collaboration with and with respect to other members of their family. Now, if the members of their family are not acting proactively and participatory, there might be a failure to utilize the doctors. But it's not because the women are just not making decisions to visit the doctor, but it's because of the way that decisions are being made within the household. It's because the way in which members of the household are relating to each other. And if members of the household are not behaving in a proactive and a participatory way, there might be reasons why the women are not able to access the doctor visit. So, for example, if the husbands in these families are not acting proactively and participatory, they might fail to provide the type of material, relational, and social support to their wives that their wives need in order to make it to the doctor. Perhaps the husbands are not recognizing the need in their wives. They're not talking to their wives. They're not communicating effectively with their wives. And so the women are not making decisions in radical isolation, but their decisions are influenced by the way in which their husbands are relating to them and the way in which they're relating to their husbands. And so there's a relational constraint. There's a relational constraint on the utilization of these mobile clinics. And if we are able to help the members of the household, husbands and wives, to be proactive and participatory, we might help the whole family. We help mobilize the whole family to be able to make it to those mobile clinics. Okay, so how does that influence the design of an intervention? Well, a conventional proposal to address the problems would be to introduce material interventions that relieve those material constraints. So let's say provide women with vouchers to pay for a taxi, or provide some other transportation support, or perhaps increase the number of locations that the mobile clinics visit. That would help reduce the travel constraint. And you also could provide women with educational programs on the importance of prenatal care. Now, these are the types of conventional interventions that aren't bad. They're great, and they should be an important part of helping to solve the challenge of low utilization of the mobile clinics. But these types of interventions are insufficient because they do not think about the recipients as social persons. And so they do not recognize how the network of relationships within which the recipients exist have a significant impact on the decision-making process. So when we use the integral approach, it helps us to recognize that these material interventions are important but insufficient to ensure the success of the program. We need to address the relational dynamics. We need to address how the persons are relating. So let's think about some interventions that would be influenced by the integral approach. So when we use the integral approach, we can think of some different interventions that might help. So 1, conduct whole family education programs or husband-specific education programs. Require husbands and wives to attend educational programs together. Why might this be effective? This might be effective because an educational program on the importance of prenatal care that engages both husbands and wives can help to promote husbands and wives to consider the needs of each other. And so in the context of prenatal care in the West Bank, it might be essential that the education on prenatal care not just simply go to wives, but it goes to husbands, because it helps the husband to understand the needs of his wife. And it helps the husband to be more proactive and say, oh, hey, I need to make sure I'm checking in with my wife and helping my wife get to the doctor the appropriate numbers of times. And so an educational program that engages both husbands and wives collaboratively might be much more effective because the program is not targeting individuals that live in radical isolation. They're targeting social persons. So an intervention that targets the whole community in which the decision is being made, so in this case the community of the family, might be much more effective than a program that simply targets individuals. Okay. Another would be to adjust these mobile clinics so that they provide comprehensive medical services that encourage entire families to see the doctor together. Again, this engages with the whole household. It helps to promote different members of the household considering the needs and the well-being of the whole entire household. It sees members of the household as members of the household and not radical individuals. And later in the course, we will learn about something called stage field experiments that can be used to help promote proactive and participatory decision making. Okay, with that, we'll conclude the integral approach to RCTs, and we'll talk about it more in class. We'll read a paper that utilizes the integral approach to conducting an RCT, and we'll see how using the integral approach can help to improve outcomes. Thank you, and I hope you have a good day.